Countries around the world are seeing a resurgence in COVID-19 cases after successfully slowing outbreaks early in the year. While others are experiencing a second wave, countries like Germany and India are in the third wave. Today on Soundhealth, we will look at precautionary measures against a second wave in Nigeria. I am Olasunbo Modupe. Welcome to the show.
The World Health Organization chief, Tedros Ghebreyesus, said there is an urgent need to address the financing gap to provide COVID-19 vaccines for everyone and everywhere. In an appeal for stepped-up funding to support poorer countries, Ghebreyesus explained that the United Kingdom has begun the rollout of a vaccine developed by pharmaceutical companies Pfizer and BioNTech, and more nations are expected to follow suit very soon. However, the WHO chief added that it would be an even greater achievement to ensure that all countries enjoy the benefits of science equitably. Nearly 190 countries are participating in the COVAX initiative, and the goal is to deliver 2 billion doses by the end of 2021. But there is an immediate funding gap of $4.3 billion to procure vaccines for the most needy countries. WHO says it will review strategic priorities towards the drafting of financing framework in order to close the ACT Accelerator's financing gap for 2021. Presently, COVAX is in discussion with several other manufacturers, and further deals will be announced in the near future. Ghebreyesus added that WHO is working simultaneously with Gavi and UNICEF to evaluate the first set of requests received from countries who are eligible for assistance through the COVAX facility. The Nigeria Center for Disease Control (NCDC) has advised members of the public to increase awareness about the continued risk relating to the COVID-19 pandemic, especially the need to prevent the spread of COVID-19 during Christmas and New Year celebrations. The agency cautioned the public to limit all non-essential domestic and international travel, especially from countries recording a high number of COVID-19 cases. As an alternative to travel, the public should limit festivities to members of immediate household while remaining physically distant, remain socially connected with friends and loved ones using mobile or video conferencing technology, as well as hold virtual services and prayer sessions to limit mass congregation. Lagos State Governor Babajide Sanwo-Olu is currently undergoing treatment following exposure to COVID-19. Commissioner for Health Professor Akin Abayomi disclosed that he is currently experiencing mild symptoms and fatigue but responding to treatment. Over 72,000 COVID-19 cases and above 1,100 deaths are reported in Nigeria. Globally, there have been more than 70.2 million confirmed cases of COVID-19, including about 1.6 million deaths reported to WHO.
It's still Sound Health on Lagos Television. An epidemiologist and public health physician, Dr. Ajoke Adewale, will share with us precautionary measures against a second wave of COVID-19 in Nigeria. Dr. Adewale is joining us via Skype. Welcome to the show, Dr. Adewale.
It's nice to be here. Thank you.
Okay, how has the country fared in the fight against COVID-19? In the
So
fight
the
against
country has fared
COVID-19?
quite well in the sense that we've been able to make sure that the deaths from COVID-19 are at a bare minimum when we compare it with other countries. And by and large, despite the fact that there have been itches and lack of cooperation by people to follow the preventive, by some people to follow preventive measures, we've been able to make sure that we don't have so much as a death toll. So by and large, I can say we did quite well. When you say how did we fare so far, we fared quite well. Mhm.
Let us look at other climes now. Germany is experiencing a third wave. Could there be a second wave in Nigeria?
Yes, there could be a second wave, and in fact, we should start preparing for a second wave. I mean, what use is it for us to fold our arms and pretend like nothing is going around globally when the whole world, when in many parts of the world are on fire, practically literally on fire in terms of COVID-19? We had a first wave. What prevents us from having a second wave? These people had a first wave, it resurged, and they had a second wave, and then a third wave, particularly with the way we have relaxed in terms of sanitizing our hands, wearing face masks. We have relaxed even in terms of transportation measures. If you go to a regular car park in Nigeria, people have returned to their former methods of sitting very, very close to one another and so many other things. So a second wave, I dare say, is imminent. But what matters most is how well we are preparing for it as a nation. We should not fall into the same situation where we had we had it going all around and we did not prepare well. This time around, we should be well prepared and we should put in all the measures to make sure that the second wave does not result in further morbidity.
What factors determine a second wave?
Now, the factors that determine the second wave usually is the fact that, definitely there is no herd immunity. When I mean herd immunity, it's immunity that the the members of a group have. If we are living in a community and let's say 80% of us have developed immunity against the disease, if the disease comes again, it's unlikely that the disease is going to come back in terms of a second wave or a surge in high numbers. But unfortunately, concerning COVID-19, we've not been able to determine exactly whether we have herd immunity. What we are seeing is that even people that have been infected before can be infected again. So a second wave is imminent because of lack of herd immunity, which we don't have an advantage with. It can also be imminent because of reducing our standard, relaxing concerning being lax concerning our preventive measures. We no longer wash hands like I earlier mentioned. We do not test as often. The fear, the apprehension concerning COVID-19 is gone. So if a case of COVID-19 is within, let's say, school premises or a community where people are not dedicated to preventive measures, it can easily spread. Now people are getting back in churches, in mosques. People are going back to their parks. They are dancing. They are taking off their face shields, especially their face masks. Therefore, we can say that the second wave. Those are the factors that can propagate a second wave.
Okay, some
think is imminent.
Okay, some school of thought say because the country has not recorded a single digit case, hence there is no need to panic over a second wave.
When we say a single digit case, we are talking about single digit numbers. The country has recorded single digit numbers, unless I'm getting the context of that question wrong.
You're right.
The country has, and in which case, if you are saying, our numbers are not the way the numbers of countries what countries like Germany, US, UK are experiencing, we are right. Definitely, those in other countries they are dying more from the disease, and they are being burnt more by the scourge of the disease. But we do not have to wait. It's not a trial and error thing. The world is a global village, and we need to make sure that that we are putting things in place. The last time we kept on having this kind of lackadaisical attitude, like, this our temperature is different, our climate is different. But I would dare say that instead, preventive measures, our isolation centers, testing facilities should be put in place so that in case we have numbers that are gradually going up, we are prepared. We do not have to wait to have those kind of numbers before we decide to do what is right.
All right. Can the country's testing capacity be compared to the number of confirmed cases? Is testing enough to gauge where we stand now? Yeah.
Obviously not. I don't think our testing facilities, as a public health physician, I am saying with experience and with, the experience and the work on the field, that testing capacity is definitely not enough, and it is not as much as what is operated in other countries. But are people also utilizing the huge testing centers we have? When we say it is not enough, and we mean that considering our population, the fact that we run into millions in Lagos alone, we should have more people coming to test for even cough. Oh, even if it is not COVID, they later find out that it's not COVID. But if you have a community where there's a high suspicion of COVID, people with cough, with catarrh, with respiratory symptoms will still come and test. But what we find out is that even though the testing capacities are supposedly not enough, people are no longer turning up in their numbers for testing because they no longer see it as an issue. And that's where health education comes into play. There should be constant awareness, training and retraining of health workers, of the community members, of stakeholders, of local government officials.
Can this be attributed to disregard for precautionary measures in the country?
Of course, this can be attributed to a great deal to the softening of preventive measures in the country. Not only are people relaxed, we have found out that people do not take this seriously. Even the government has stopped enforcing rules. I mean, maybe they have not stopped, but the reduction in enforcement is obvious. They may say they're enforcing it, but you and I live in Lagos, and other people live in other parts of the country. When we go to the parks, are there still sanitizers there? So people no longer enforce it and no longer practice or implement preventive measures. And also, you find out that the enforcement, human beings work with enforcement. If you place a rule and say people should wash their hands, or you say there should be less aggregation in a particular, nowadays even restaurants, they tell you to wear your face mask before you enter. But once you enter, everybody's face mask is down. So yes, our preventive measures are softened, and that can be attributed to it.
Okay, what approach can be embraced or imbibed by key players?
Now, this is where I say that everybody is a key player. I want to identify the key players, starting from the government, to the international community, starting with the international community, World Health bodies, then the government, then the health workers, then the community leaders, the political leaders, the people that are in the limelight, the leaders, even the musicians, then to the community members themselves, the woman, the child at home, you as a man in the house, we are all stakeholders. So the role of the government is to make sure that there are facilities in place, that the populace is constantly educated concerning COVID-19 and what is currently going on. Also, the mass media is a stakeholder. Mass media outlets and stakeholders, are they reporting the news? Are they still talking about the urgency of COVID-19 in our current community? Are they displaying the numbers and bringing to awareness, to government leaders about why there's still a need to make sure that COVID-19? So thankfully, stations like LTV, like your own station, LTV, they're doing very great. But, we need to make sure that everybody recognizes their roles and plays that special role they have. I'm a stakeholder, I'm a doctor. Women at home, or even non-doctors, other professions or non-professionals, are you washing your hands? Are you using your hand sanitizers? Are you using your mask? As a health workers, are you using your PPE correctly? Do you have an high index of suspicion? Or are you waving over anybody that has cough and say, oh, I'm sure it's, even if it is COVID-19, I'm not going to flag it up as COVID-19. Everybody has a role to play.
Okay, Dr. Adewale, we know some countries are already seeking an emergency use authorization of the vaccine. Is it safe to botch the required protocols for vaccine approval?
Now, emergency, when a vaccine is being approved as
for emergency use
authorization, what has happened is that they're skipping phase 4. Before a drug or vaccine is approved, it goes through 4 phases of clinical trials. Phase 4 involves, making sure over and over again that, it is efficacious and it is safe. Though phase 1 is the most important for safety. Phase 2 also deals with safety. Phase 3 borders on dosage and makes sure that, even the people that need it are getting it in the right dosage. So when you do 3 phases out of 4 phases, that you have done 75% of the whole process, right? So it is likely safe. I use that word guardedly. and trust the scientists will not give. We always do phase 4 to be double sure, and it is done over an extensive period of time. Before a vaccine is given that authorization, what happens is that they have weighed the advantage against the disadvantage. If we delay this vaccine and more people likely to die, meanwhile, we have 75% proof that this vaccine is efficacious and safe. What are we waiting for? So COVID-19 vaccine is one of the vaccines that has passed that test about weighing its advantage against its disadvantage. Do we release it now or do we not release it now? That being in mind, we may never know the actual effect or the actual value of the vaccine until years and years of study. But can we really wait when we determine that it's 75% safe? That's the question countries are answering, especially countries that have high mortality. When people are dying, would you rather they just use this vaccine and stay alive than, and prolong their lives than keep on, doing tests that just buttress the point that they are safe? So it's a delicate balance that people have found for those that are asking for EUA, that's emergency use authorization.
Okay, before I let you go, Dr. Adewale, do you see the country privileged to access the vaccines now?
Is Nigeria privileged to access the vaccine?
Yes.
Well, the vaccine should be distributed under equity, and the laws of equity says that it goes to where it is needed. Ideally, the vaccine should go to where it is most needed. Now, and there are factors that you are consider when you consider where it is most needed. And where are people dying the most? Where is the population likely to expand? Where is like the economic hub where most people go to? If a country like Nigeria, Lagos is our economic hub, for instance. So there are countries like that people will always travel to. People will always go regardless of your restrictions. And so if Nigeria falls on that criteria, it's left for the international community to decide. Bear it in mind that even though that's the ideal setting, things like political power, economic power, social power play into these roles. And so Nigeria definitely is my country and qualifies to have the vaccines. But like I said, because vaccines like this are not usually available in so much quantity, they give it to places where the mortality is most and where people will most likely go to, and where the population is very, very explosive. I believe Nigeria should be ratified in due time because Nigeria has a very high population. If people have it in Nigeria, Nigerians are all over the world. So we will get there, but I think they are prioritizing countries with higher mortalities now.
Thank you so much, Dr. Adewale, for your time and expertise on the show.
It's always a pleasure. Thank you, too.
Okay, I have been talking to Dr. Ajoke Adewale, an epidemiologist and public health physician, on precautionary measures against second wave of COVID-19 in Nigeria. Soundhealth continues with trending health reports. Please stay tuned. No doubt, the only hope against COVID-19 is the vaccine. However, pending the arrival, strict adherence to precautionary measures such as hand washing, use of masks, and social and physical distancing will reduce the risk. Stay safe. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 08035 826603 or follow us on social media. TV Social, hashtag Sound Health. A sound health is a sound mind. Make health your choice.